For over 5,000 years of documented history, people have been using the cannabis plant as medicine. From ancient Chinese medical journals to the modern-day dispensaries, cannabis and its many medical uses have found their way to every continent on Earth. Today, as the prohibition against this plant is slowly being lifted around the world and our technological capacity grows exponentially, we finally have the opportunity to discover what this plant is truly capable of. Please join me, Matthew Myro, as I speak with the remarkable innovators working at the cutting edge of these discoveries. This is the Edge of Cannabis Medicine. This episode is brought to you by MJ.com and their brand new medical platform that they're rolling out in the San Francisco Bay Area. Have you visited MJ.com? MJ.com is the most trusted information source for all things cannabis. Whether you're a medical marijuana patient looking to find the right doctor or a consumer looking for exclusive savings at your favorite dispensary, MJ.com can bring you your favorite products right to your front door. Or maybe you're just a lover of the cannabis culture looking for the best original articles, interviews, podcasts, and educational information. MJ.com is the number one place to find everything you need. Visit MJ.com today. Hello, beautiful people, and thank you for joining me for today's episode of the Edge of Cannabis Medicine podcast. You're here because you know that you want to get the very best information out there about medical cannabis, and this is the place to do it. I am seeking out experts and innovators all across the medical cannabis space in order to bring you all the very best information possible. And speaking of y'all, please head over to Stitcher, head over to Apple, leave a rating. It really helps for more people to see that this podcast exists and that they can listen to it and get this information and educate themselves on this incredible plant. And please, please reach out to me, Matthew, at edgeofcannabismedicine.com. Let me know what you think of the show. Let me know how I can do better, what guests you might like to see. I'd love to hear from you, and I want to be able to talk to you. So please do that. And today's guest is Mr. Mark Mangieri. Mark works for a company called Hemp Synergistics, and they have created a really, really innovative process of taking raw hemp oil and converting it into a powder in a way that nobody's ever done before. So it's 5 times as strong, it has no taste, it can be mixed in really easily, and used for creating different formulations. It's super cool. We get really deep into the details of how this works, and it was just really fun talking to Mark. He's a great guy with some really great experience in the nutraceutical industry. One thing I do have to warn you about, though, is that there sounds like a little bit like somebody's moving some stuff around every few seconds in the background on Mark's end. Not really sure what that was. Hopefully it's not too distracting. I tried to remove as much of them as possible. But if you can get past that, it's a really fun conversation with lots of great information. So please enjoy this episode with Mark Mangieri. I am Matthew Myro, and this is the Edge of Cannabis Medicine podcast. And today's guest is Mr. Mark Mangieri. Mark began in the nutraceutical industry in 1998 and started product formulation in 2000. Since then, he has launched 6 brands, including his own brand, in 2005. By 2015, that startup product reached the shelves of every GNC and vitamin shop around the country. And from there, Mark transitioned into creating functional foods and fortified snacks, which led him directly into his current role as the Director of Sales and Product Development at Hemp Synergistics, which is a biotech company that provides high-quality THC custom cannabinoid formulations. That was a mouthful, but thank you so much, Mark. Welcome to the show.
Matthew, thanks for having me. It's really cool to be here.
Great. Now, normally on my show, I'm speaking to a lot of different researchers and physicians and shy away from specific products, as I'm not trying to plug products, but you really struck me. I have to give a shout out to Marissa for connecting us. And your product isn't specifically a product as much as a new way to process cannabis. And I found it to be fascinating. So if you wouldn't mind, maybe we can backtrack a little bit, and if you don't mind sharing how you made that jump from traditional nutraceuticals over into the cannabis world as a nutraceutical.
For sure. And you hit the nail on the head right off the top. We see the CBD and the other cannabinoids not necessarily as an industry or a retail locations like the CBD shops. We see it as an ingredient to be used functionally in a variety of different ways: nutraceuticals, functional foods, and that's how it became a good fit for me. And so, in backing up, in high school and early college years, I was really into sports and training and all that entails. And I got into sports supplements just as a part of the culture and to increase my performance, and became engrossed in how they work and why they work for me specifically, and the science behind it. At the time, I was at Penn State. I was an agriculture and food science major, so it kind of played into a lot of the topics that I was actively learning about. Penn State was one of the pioneering universities to first study creatine monohydrate on the baseball team. So it was specific, very specific to me, what I was interested in, what I was doing. And it kind of grew from there. After graduation, I found myself back in Pittsburgh. That's where I'm from, working for a contract manufacturer of nutraceuticals. And my fascination and just general curiosity kept growing. And by like you introduced me, and by 2000, I became part of a product development team and started a few brands. And then in 2005, I started my own brand, and it was called Biorhythm. And we did pretty well. It was a slow growth process. And along the way, if you remember, from like the late 90s all the way to recent years, there's always some new ingredient in the news that's making headlines, right? And I can't even remember them all, but you'll see a spike in popularity and then a drop off. And it usually takes about a year or 2 years to see the spike and then the drop off. And when CBD and the different cannabinoids start becoming more popular, of course I paid attention to that because it's where I came from. I was in functional foods by then. But it maintained its popularity, and then it kept growing, and it's growing at a point that's it supersedes any other previous popular ingredient. But this one was different in that they were all the products that were coming to the market were only or significantly built around the CBD phytocannabinoid, and that was the strange thing that struck me as a product designer, is why it's just this one ingredient? Why not couple it with other ingredients? And just being in the industry and knowing people in town here, I came across Hemp Synergistics earlier this year, and I got a behind the scenes look for the first time of what's going on, how this works. I spoke to farmers. I spoke to processors. What we do here is we're the last stage remediator. So we take it from a crude oil to something extremely refined, ready for consumption. And so I learned about that process as well. And the idea of all these products and stores and companies all built around this one ingredient struck me as something that's going to change really soon. And so my conversation with the management here was, I see this as an ingredient, and here's the way, if I come on board, here's my angle. And initially it was just, let's make a brand and use CBD as one of the ingredients. But the reason why there's not very many products out there with significant support ingredients into these different tinctures or soft gels is because CBD and the other cannabinoids and hemp oil in general is very hard to work with. It's very viscous, sticky, right? It's prone to it's prone to oxidation. Sometimes you'll see like darker spots. If you get your hands on a pure THC-free broad spectrum distillate, you'll see like brown spots on it. And oftentimes you'll see tinctures that have to be in dark bottles or gummies that are packaged dark. And that's to protect it from oxidation. And we can get into how and why that occurs. And so our goal as a team was to turn that into something that's more durable, more functional. Can we use it in different applications and affordable? That's another component is the pricing is still very high because the technology to bring it to a finished good, a lot of hands have to touch it. It has to run through a lot of very expensive equipment. And so that's pushing and keeping the price high. And so what we developed was a way to turn that sticky, viscous hemp oil into a very dry, free-flowing powder that's protected from oxidation. This powder will not turn dark. It is not affected by sunlight. It's not affected by just open air. And those are a lot of risk factors for a high-potency hemp oil to lower its quality, lower its biological value. So the product that we developed is called BioDry, and its sister product is just plainly named CBD Bake Mix. And the BioDry has a CBD concentration of 50%, and the CBD Bake Mix, which is much more durable for obvious reasons, has a CBD content of 20%. And that's a long distance from 1998 to literally about 2 weeks ago. But that's the short story. And again, the reason why we're excited and we're doing a decent amount of press on this is because it's an industry first, and we see it as a change in not only how CBD is taken, but also how CBD is perceived. And again, I lead with CBD, but the other minor cannabinoids are equally as important, and the same science and refinement techniques apply to all the cannabinoids. So the very long story short is turning it into this powder gives formulators and end users freedom and flexibility. It gives formulators freedom to now put products like this into a hard shell capsule and then complement it or accentuate the effects with other ingredients, whether it be, immune boosters, vitamin D, zinc. That's obviously popular now. General multivitamin, for daily consumption, all the way to sleep aids and you name it. So it's going to open the door to a big variety of possible benefits.
Yeah, absolutely. So thanks for diving into all that. So I have a lot of questions. We're gonna go real deep into all of this. So trying to figure out exactly where to start, but I'm going to start with the other minor phytocannabinoids that you had mentioned. And this is something that really grabbed my attention about this product, is that it is not working as an isolate. It is working with what they call full spectrum. And I've spoken to a number of different physicians that have been working in the field for a long time about this conundrum of isolates versus full spectrum. And there is 100% agreement across all the physicians that full spectrum is far more effective. And so it was really good to see that you are including that into this product here. And so if you don't mind diving into that just a little bit, talking more about some of these, what you call minor cannabinoids.
Right. So I think one of your podcasts, you talked about the need for more research, right? And so the currently CBD and other cannabinoids, there's about 2,200 studies done in the last 2 years on CBD. Now that may sound like a nice number. In total, I think there's about 6,000 or 7,000 studies done on it. And again, it looks like a big number. By comparison, I mentioned earlier about creatine, started back when I was in college in the mid-90s. Creatine currently has 60,000 studies on it. And in the last 48 months, there was 6,700 studies done on it. Now, creatine's, effectiveness and how it works and how you should take it is very well established. But still, it was studied at a rate 3 times higher than CBD, the most popular new ingredient on the market. So there still needs funding and more research done on it. That being said, and my background isn't specifically chemistry, and knowing all these details, but the minors, CBG, CBN, one of them is THCV. That's the one I'm keeping my eye on. THCV has the potential of helping people with blood sugar problems. If you look at the United States and problems with overconsumption of sugar, just general overconsumption, a lot of it at one point or another is related to or is a function of poor blood sugar. THCV, early studies show that it's extremely effective at helping regulate blood sugar in lieu of insulin. Now, I am no way suggesting that, somebody can substitute that. Number one, most of the minors are far too expensive right now because of this, the extraction techniques and the low volume that they exist naturally. It has to be refined multiple times. Some of them are becoming less expensive, but in general, these things are costing anywhere from $20,000 to $60,000 a kilo. That makes it price prohibitive outside of research. But each one of these minors are their own little superstar for various reasons, whether it be to help with anxiety, PTSD, sleep disorders, blood sugar problems. In general, they're too expensive. Now that's changed just in the last 6 months. Pricing has been coming down. So we haven't dug too deep into the minors. We know they exist and we want them present. There's something called the entourage effect. And we want the user to have that entourage effect. And so in our broad spectrum products, we have at least 2 minors detectable and others also present. So in terms of minors, that's the extent of what I can effectively, talk about. The next popular besides CBD is probably going to be either CBG or CBN. And those are the 2 that are coming down in price. And right now, the best form realistically is the tinctures. Until we get our hands on it and are able to convert it to a nice, fine, easy to use powder.
Yeah. So first of all, I spoke with Dr. Jeffrey Block, who's an expert on the endocannabinoid system. And one of the things that he is a massive proponent of is moving away from the term entourage effect and moving to the term ensemble effect. Because if you think about an entourage, it's because, you've got some central figure and then a whole bunch of people hanging around, right? That's what the entourage is. And he wants to get rid of that because that means the reason why that term first existed is because THC is the main player, and then there's the entourage of all of these other phytocannabinoids around it. It's like, no, let's not do that. Let's talk about this ensemble effect because they all work in chorus together, not just focused on this one molecule of, 130 that exist within the plant. So that's that. So I try to promote that ensemble as much as possible because I think it's cool.
I'll switch over my verbiage from now on. And it's a good point because, THC and CBD, they're the most prominent cannabinoids. But CBG, CBN, THCV, they have a far greater effect at much lower doses. And so just because they exist at 1/10 or 1/20th the concentration of CBD doesn't make them 1/10 or 1/20th effective. It just means specifically that they're effective at lower doses. And we're seeing that as research. And so they're not tag-alongs. They're the star of the show in some cases. And so that's a good point. And I'm switching over to ensembles starting now.
Cool. And also those 2 specific cannabinoids that you discussed, the CBG and CBN, are really interesting because they're age-related. And so there's a peak of CBG in about the 4 to 6 week range within the propagation process. And so if you harvest your plants earlier, you're going to have higher CBG because it's a precursor to THC. And so it starts to lower as the THC increases. So that's age prohibitive, if you will. And so you want to get the younger one. And then CBN is on the opposite end of the spectrum, whereas as the cannabis ages post-harvest, the CBN starts to grow. So it's fascinating that these two molecules are becoming more and more popular, and they're two that we have actual control over the amounts of them depending on the age of the plant. So pretty cool.
The fact that they exist that way, it kind of speaks to the way they exist after harvested, because they're both sensitive, more sensitive than CBD. They're both more sensitive to heat. They're both more sensitive to light. And so it makes it a more difficult product to manufacture if you want to do it right. It makes the storage conditions more strict. And so that gives us all the more reason to try to standardize. And that's what this is about, standardization. It highlights more of a need for us to standardize its existence, and that doesn't necessarily make it better or worse. It just makes it more stable. The fact that it can convert to THC, it's not a good thing, in an end product. The fact that it can denature when exposed to heat or sunlight is not a good thing. And so these are the problems that we're trying to solve versus just putting it in a dark bottle.
Of course. And so there's a lot of steps in the process to get to the point where you folks are working at. And so, you've got the growers and they have to harvest it and then get that product over to the processors to create the oil. And then you guys take that oil and then do your process on it in order to create this powdered product. Now, traditionally, I understand that there's this nano-emulsifying procedure that is traditionally how you go from the oil to the powder. But what you guys have done is something totally new, game changer in the industry. So if you might talk about those different steps and how you got to where you are.
Yeah. It is a game changer because of the freedom and flexibility and stability. The good thing is I didn't come from the hemp industry or the cannabis industry. When I walked in here, I didn't know much about nano-emulsification. We barely, we have the equipment to actually nano-emulsify here, but it was just used to understand the difference between our product and what's currently out there. The nano-emulsification, in addition to the normal process of getting a hemp oil into a tincture, is already very laborious. And again, a lot of expensive equipment. You then have to bring that into like a sonicator, they're called, and to nano-emulsify it. And that takes a lot of time. It produces an enormous amount of heat. When you nano-emulsify, you have to pack the product that you're emulsifying. And you can emulsify any oil, but you have to pack it in ice, and it gets so hot. And we were monkeying around, just seeing what happens if we do this or if we do that. And we had it in the sonicator, and it's like this probe that goes down into a solution, and the probe shakes so fast you can't even see it. It just looks like it's standing still. It's so violent. And if you get close to it, it makes your teeth hurt. It's buzzing along, and we see all this steam coming up, and we're like, why is it steaming? All the ice melted. It didn't even go to water. It just straight sublimated. And if you remember that from ninth grade science.
Yeah.
And so, and who knows what the temperature actually got to. And so then obviously we stopped the process. I guess my point is, when you put a product through nano-emulsification, the product is at risk. The product is at risk for being denatured, being changed into something different. You also add a lot of time, and you also add a lot of cost. After you nano-emulsify that product and you want a powder, you have to then do this spray dry process. Now, we never went that far and did it. We saw the process up to the point where we sublimated ice and thought, all right, this is not scalable in a reasonable way, right? And so, but if you want a CBD powder, you have to then get that nanoemulsification and then do a spray dry. And that's, again, it involves temperature, pressure, and takes a long time. So that's what's keeping the pricing so high. That's what makes, these drinks so expensive, is because it takes so much work to get to that point. Now, and I'm talking in terms of a powder. With the BioDry process, it's a much more linear process. It's a patent pending process, and it's a simple combination of a polysaccharide, which is a root starch, and a fiber. And at our highest concentration, the hemp oil, the THC broad spectrum hemp oil distillate, is about 55% of the volume of the product by weight. And so if you're looking for a high CBD content, we can get it as high as 50% by weight, because those broad spectrum distillates are 90% CBD by weight. And of course, like I said, the other minor cannabinoids are also present. And so the process is much more linear. It looks a lot more like a food science project versus a chemistry project. And the throughput and the scalability is far greater than the nanoemulsification route. We've successfully produced several batches. I believe our official launch is going to be at the beginning of next month. And we're confident that we can meet any demand, because it's an easily duplicated system, with minimal investment on a production side. And that's where a lot of my history is production, scalability, and monitoring that retail price, because the lower the price, the more people who are going to be able to use it. And so this whole process speaks to that, and is one of the reasons why it's such a cool new product. It's checking all the boxes that we need.
Yeah, so speaking of checking those boxes, bioavailability is a big box that y'all are checking. And so digging around a little bit, there's a pesky enzyme called cytochrome P450-3A4, or just CYP3A4. And this tends to block a lot of the efficient uptake of these different phytocannabinoids, because the stomach and the guts are producing all this. So what have you done to get around that in order to increase the bioavailability?
So the bioavailability, backing up a little bit, simply means the rate at which an ingredient makes it into your bloodstream. So let's say you take 100 milligrams of CBD by tincture. Your best case scenario is to absorb into the bloodstream somewhere in the mid-teens, like 14, 15, 16% of that is going to make it in. Soft gels are lower. They're in the single digits. And versus smoking is about the highest, about 40%. Again, a lot more research is needed on the conditions, creating the best possible scenario for you to absorb things. A lot of products say take with food or take with a fat. That seems to help. But your real roadblock is your own body's reaction to a foreign body. And I don't care how natural an ingredient is, there's a reaction whenever you put something in your body. These cannabinoids are no exception. So specifically with the BioDry, the cannabinoid has two enemies. Number one, in the mouth, your body can produce something called amylase, and that begins the digestion process in your mouth. You swallow it, it goes into your stomach, and of course you have a very, very, very acidic environment, which can also harm the cannabinoids. Specifically with BioDry and the bake mix, that polysaccharide, that root root starch, fully encases each hemp oil. It fully encases the hemp oil molecule. It protects that cannabinoid. It protects it from sunlight. It protects it from acid. Acid cannot penetrate this polysaccharide, no matter what. So the absorption of the cannabinoid begins in your small intestine. That's where most of the absorption occurs of any food or nutrient that you take. So by the time it goes, the bio-dry ingredient goes through your mouth, down into your stomach, it reaches the small intestines 100% intact. Now, I am not saying you get a 100% absorption, but by that point, you've had 0% loss. And so that alone is a huge win for bioavailability, right? And after that, your body releases these defenses, these enzymes, like you call. Now, the P450 enzyme group is a very common group of enzymes. Have you ever got a prescription and it says, do not take with grapefruit juice? The reason is grapefruit juice, there's an ingredient in there, I believe it's called bergamottin. It inhibits a very specific enzyme. And that very specific enzyme is known to attack a lot of different foreign entities, and specifically a lot of pharmaceuticals. How I became aware of it was back in the nutraceutical world. There are some nutraceuticals or former nutraceuticals that are subject to being metabolized by these P450 enzymes. And by metabolize, I mean destroy. And so these enzymes are on a mission to destroy these ingredients, specifically any hormone-altering ingredients. I don't know if you remember back in the Mark Mangieri home run derby days, the pro-hormones or the andros were popular. And these androstenediones are very prone to being metabolized or destroyed by this P450 enzyme. And back then, we developed sort of an antidote to that. And it just so happens that these phytocannabinoids are attacked in the exact same way. So when that phytocannabinoid reaches your small intestines, these P450 enzymes, specifically CYP3A4, is released and with the instructions to a suicide mission to destroy that cannabinoid. And that's where probably 80-90% of your loss occurs, is at that point. And so, again, speaking to the very concentrated nature of the powder, if you put it in a pill, you can add other ingredients in there to counteract these enzymes. And that we put together a group of ingredients named CannaBoost that are designed to temporarily inhibit those P450 enzymes that are known and very easily predicted to attack the cannabinoid. And there are ingredients like naringin, black pepper extract. We use a brand name Bioperin. Curcumin's one of them. Sometimes you'll see people use curcumin. And those ingredients are great anti-inflammatories on their own. A lot of people take them just as is. But specifically, when you couple them with a CBD or CBG or CBN or any cannabinoid, they are there to increase the bioavailability by temporarily inhibiting those enzymes from attacking this cannabinoid. It's well-established science on how this works, and for some reason, it just hasn't been addressed in this industry yet. And so we're real excited. We have a capsule product coming to market to sort of demonstrate that these two ingredients work really well in concert together, or these two groups of ingredients work really well in concert and produce a cumulative, very positive biological effect.
Yeah, I was so excited to see that. I've been using Bioperin for a long time just because I want to get the most out of my turmeric or curcumin, you know?
Yes.
And seeing how that they can work together, and specifically seeing curcumin in a formulation with CBD, because I don't know of two more anti-inflammatory products that exist on the planet. And so seeing them work together and then boosted by the Bioperin was super cool.
Yes.
You have 2 thumbs up from me on that one. Good job.
Thank you. And the Bioperin is produced by a company called Sabinza Corporation, who's been in the industry longer than me and producing at a very high level. They've done their own studies specifically, and the bioperin increases the absorbability of the curcumin, which increases the absorbability of the CBD. So it's this nice ensemble of ingredients that really and truly complement each other in every way possible.
Yeah, very cool. It's very cool. So wanted to back up just a little bit. And so you guys claim that the BioDry has 5 times the concentration of these other nano-emulsified powders. So number one, how are you able to prove that that's the case? And number two, I mean, I know you can't get into any specifics, but what is it that you're doing that's able to allow you to have such a small amount of it have the same efficacy of something that's 5 times as much?
Well, the short answer is we have a different process. We started doing this BioDry before we understood what nanoemulsification was, which is a good thing. One way to keep an open mind about any process is to not really dive too deep into what the standard is, right? And not to throw shade on the standard. It's just sometimes it can sway you in the wrong way. And let me go off track real quick. Before I came on board here, I was into the functional foods, and I had this idea to make an almond butter keto truffle. So it's an almond butter core and this, souped up sugar-free chocolate that's, 1 carbohydrate, 2 carbohydrates, and 0 grams of sugar. And I said to myself, do not learn how everybody else makes a truffle. Just figure it out yourself. And then when you got it down, go back and look. And so I did it. It literally took me 2 months to figure it all out, exactly how to do it. And then I went to, how it's made on YouTube, and just to see what they do. And don't they do it exactly the same way I figured it out? Exact. And so sometimes that can come back and waste time. But now I was so intimately familiar with every step of the process that I knew it backwards and forwards, and I just didn't have to follow instructions. And so that's what we did with the BioDry is we just dove in and just did it the way we intuitively or calculated it should be. And that's how we got 50% concentration. Now looking back and fully understanding this nanoemulsification process, there's a lot of steps to where if your goal is to have a concentrated powder that are unnecessary. Nanoemulsification exists so that you can put a concentrated liquid into a larger vat and dilute it out and then have this CBD drink. The powder version of it was an afterthought, in my opinion. So they got this concentrated liquid and then they spray dried it. And your maximum concentration that we've seen is maybe 15, 16, 17%. Most of the nanoemulsification powders are like 4 or 5%, 10%, around in there. And the formulas are wonky at best. They have a strong taste. They have, they'll make you change your recipe. They're acidic. The BioDry and specifically CBD Bake Mix has literally 0 impact on taste. It has 0 impact on the recipe. You just add it in. It's so concentrated. It's not voluminous enough to affect what you're doing. It's such a small percentage. And so how we were able to do that is not pay attention to the way it was currently made and sort of soil our thought process and try to make that process better. We just never learned it in full and just did it our way. How do we know it works? Well, we send the product to a third-party lab and have it analyzed, not only in its pure powder form, but to put it in a muffin or a capsule and test the product as a complex, test the ingredient as it sits in a more complex product, just to make sure that, okay, it stayed stable through whatever process it went through to get to that final product, and it works. The next step is we partnered with, we have a variety of partners in different industries. We have a doctor who specializes in rehab therapy. who is using some of these ingredients with her patients. That's also enrolled into a peer-reviewed case study, and so we'll be able to judge the real-world efficacy of these ingredients in finished products, and so that's how we come to the ingredient, and that's how we know the ingredient is going to be effective.
Yeah, and so I saw that you have a partnership with Gimway Farms.
Yeah, Grimway. Grimway is a the largest organic farmer, I believe, in the United States, and they got into the hemp growing business. And unfortunately, for farmers, it's been a tough go in recent years, where the biomass that they produce is not very valuable. It's not as valuable as may have been sold at one point. And that's a function of, just a lot of people growing it. And like I said, it takes a lot of work to bring it into something valuable. And so our partner with Grimway is nice because we have a giant supply of ingredient. They're very consistent in their grows, and we're not as prone to market fluctuations in price as other companies might be. So, you have this agreement that allows us to have a large amount of product at a very consistent price over a long period of time. And, if I'm a brand and I'm looking at one of these ingredients, that's one of the things that I'm concerned about. Over the years, you see these shortages and spikes in price of various commodities. And so the way to lower your risk against that sort of flux or shortage or whatever is through these long-term relationships. And we're real happy to be partnered with a company like Grimway.
Yeah, that's great. And so now the farm bill that passed in 2018 opened a lot of eyes, and it opened a lot of doors for this industry. And one of the things that it made very clear very quickly is, actually, it hasn't made it very clear. I wish it were more clear, but the different concentrations of the phytocannabinoids in different parts of the plant. And so for a long time, there was there's the marijuana part of the plant, and then there's the hemp part of the plant. And now, because of the wording within the Farm Bill, we're able to use the flowers from the cannabis plant that has extremely low levels of THC in order to extract the most possible phytocannabinoids from it. So I guess this question is twofold. Number one, is Grimway taking advantage of that? And so you're able to use the flowers as the base for the extract as opposed to the less concentrated leaves and stems and things like that. And so I guess we'll just start there.
Yeah. So whenever you're making an ingredient, whenever you're making a product, you do have to declare on the label where that active ingredient came from in terms of the part of the plant. And so the aerial parts or the flower is where most of the cannabinoids live naturally. There are some in the leaves, there's some in the stems. I'm speaking a little bit out of school here because I am not a farmer and I'm not an extract person, but just knowing that in general, so that's where you get the most for your labor dollar. And that's kind of how you have to think, in my opinion. And so if you're able to harvest these buds and put them through the first level of extraction, when we get the product, it's at the crude stage. We're not dealing with biomass. There's a lot of crude extractors out there. And sometimes you get some pieces of plant and, it's not a clean product. It's not ready for general consumption, but it's 25% of the way down the road. It took that big first step from something that grows out of the ground into an oil. And so the flower is where you get the most bang for your dollar. And so that's what we're receiving from the Grimway fellows. And even if we go to a local farm and need something specific from somebody else, that's what we're sourcing.
Cool. Very cool. So now you're in Pennsylvania, correct?
Yes.
And so Pennsylvania has a very robust and growing medical cannabis industry.
Yeah.
And so you're specifically working in THC-free zones right now, but being in a state where it is legal for THC, do you have any plans in creating extractions along those lines? Because I imagine that this product would be incredibly beneficial for that side of the industry as well.
Well, not specifically. And I'm not real familiar with the THC laws in the state here. I know it's not approved for recreational use, but for medicinal it is. And my understanding is it's not very hard to get a medical card, which is good news. That's very good news. But for us, the way we see us possibly interacting with that side of the industry is this bio-dry product is actually a process that can be applied to any cannabinoid, including THC. And so changing it from, again, a sticky, same thing, viscous, prone to changing because of the environment where it is, heat, light, that sort of thing. Changing it over into this bio-dry form is how we would interact with the THC community. And we're open to that, but we don't deal with THC in-house here, and I don't think there are plans to get into it. We have our hands full with, what we're doing. We're, really changing the way this ingredient is going to be consumed. So that's consuming us for right now. But we have talked internally about applying this process, this bio-dry process to THC oils to make them more accessible and easier consumed and open up the variety. There's still a little bit of a stigma attached to it as compared to CBD, and so we have a little way to go in Pennsylvania. But I see us working with that side of the industry in the way of lending our process to them.
Right. Yeah, because it would be so beneficial, because some of the major issues with THC-based medicine is that for the fastest action, you have to smoke it or vaporize it, which is not ideal. It's not super healthy. Right. And then the other side is an edible solution or even a suppository solution, which has negligible efficacy. But the edibles tend to be sugar-filled confections, which is not the healthiest way to go. If you could have a small amount of a pill using this bio-dry process, it could really help the process, especially for folks that have stomach issues and things like that, which THC is very, very good for. You don't want to be eating food, but if you could have just a tiny amount. Anyway, I'm rambling, but I see great possibility there for you guys.
No, you're not rambling, and it is important. And I do know that about your bout of IBS, and I have a severely autistic son, and he can't smoke. He doesn't understand the idea of smoking. To force an edible down his mouth, I can't see that being something that I would want to do to him. So as a young adult, which he's going to be soon, if it were a simple pill, that's much more therapeutic. It falls in line with our version of normal, in the United States at least. And in the pill form, all those same technologies with absorption and instead of doing a 20 milligram dose of THC, maybe you could bring it down to 5, save some money, and just have a 90% absorption rate, and so biological value. So I'm not saying that's what it would be, but that's the real world benefit of these types of ingredients, is getting more out of less and not having to spend as much money to get there. And then you widen the audience, whether it be THC, CBG, CBD, whatever. That's the goal here. Make it easier to consume, reduce the costs, and widen the audience.
Absolutely. So I'm going to take a bit of a tangential turn, put the focus back onto CBD. Now, with the Farm Bill, I think it had a lot of unintended consequences that the government didn't foresee. And one was, CBD gummy worms in a gas station. I don't think that they saw that happening because of this Farm Bill, but they did open the door for that to be a possibility. Now, the latest, before all this COVID stuff happened, there were some rumblings out of DC that the FDA was going to take a really strong look at CBD to see if it needs to be reclassified away from a nutraceutical towards a pharmaceutical. I'm wondering if you have any understanding around that being a possibility, or any plans to work more in that direction if that's the way the FDA should choose to go.
Well, the regulatory is the big, ultimately unknown variable here. And will it become a pharmaceutical exclusively? I seriously doubt it. I seriously doubt it, because it has permeated so many sections of just the free market, from whether it be a gas station or vitamin shop or your doctor's office. I mean, literally, it's everywhere. It's weird. It's at video stores, and it's just it's strange. And here's what I tell people when they say that in a negative light, which I get. The reason why it's so popular is because it works.
Definitely.
The end. Now, it's also profitable right now. There's a lot of price gouging going on, and so that lends itself to some unscrupulous business practices. And you'll read in the news about improperly labeled products, or products that don't meet label claim, or silly claims that people make on the label. And so what we see is regulatory coming in and curbing those activities. Putting a high standard on the labeling and testing, maybe even a higher standard than other nutraceuticals, which fine by me, right? But to completely eliminate it, I think that the backlash is going to be too great. I think it's a step too far. And ultimately, the FDA and those governing bodies are run by people, and people, there's this human element to all these different regulations. And I've sat down across the table from various FDA administrators over the years, and their goal isn't to prop up pharma. It really isn't. It just so happens that there's one company out there, GW Pharmaceuticals, who's been working on this cannabinoid since 2003 and really studying it. And they put some serious work into it, and they deserve a big cut of what's going on. And so that's one of the big hurdles is understanding how can this ingredient exist both as a pharmaceutical and a nutraceutical, because that's the way it is right now. And at the top of the podcast, you talked about isolates. An isolate is a sure way to attract some negative attention by the FDA, because that's more the pharmaceutical side. And I'll give you an example, like, say, white willow bark. White willow bark is a common herb or nutraceutical, or however you want to classify it. And the active ingredient in white willow that helps alleviate pain is salicylic acid, I believe, or something like that. And it's maybe, let's call it, and I don't know its natural percentage concentration, but let's call it, it's naturally present at 10%. This active component within white willow. If I refine that white willow to make it 99% active ingredient, then I got a pharmaceutical, and now I'm infringing upon. So the idea that an ingredient has to exist in either pharmaceutical or nutraceutical is wrong. There are plenty of ingredients that exist in both categories. The FDA is going to step in and say, give some maximum concentration levels. They're going to be very strict on claims. They're going to be very strict on potency. They may even recommend a maximum potency. Can't go more than this many milligrams per serving. All fine with that. But in terms of regulatory, that's the approach I see them taking, is more of this coexistence. And that's truly the responsible approach, unless some new science comes out that we find out how damaging the ingredient is, which there's no signs of. Outside of that, I see this coexistence of pharmaceutical, nutraceutical, and food ingredient all at the same time, just with pretty strict regulations. And that'll weed out some of the smaller companies, unfortunately, but it'll also raise the standard and just in general bolster the reliability of the product that you're seeing on the shelf. In short, we welcome regulation, responsible regulation, in the way that I described.
That's great. And it's a really wonderful explanation too. So thank you for that. Nailed it. So just going to be wrapping up a little bit here, but one thing that I wanted to touch on, and it excited me also, is that you shared keeping an open mind and sleeping on things, and using sleep as a productivity tool and an innovation tool as well. And I thought that was really convenient, as you being in the CBD industry, which helps with that deep sleep, bringing that delta sleep actually in. So if we could talk to that just a little bit.
Yeah, man, I forget the name of the doctor. It was a podcast that I listened to, and it first brought that idea to me is the term. All these old sayings, sleep on it, I can't think of another one, but it comes from somewhere. And so, a good example is my daughter, who's 11. She's a pitcher for softball, and she's trying to learn a changeup. And a changeup in fast pitch softball is a really wonky thing to throw. It's very, very unnatural. And so I said, listen, Julia, let's just do this like 100 times. Let's just do it and pump it out as fast as you can and then not think about it. And sure enough, the next day, she was 10 times better and way better than how we left off. And your body has this ability to replay these events that happen during the day, and the ones that you put a lot of focus on tend to get replayed again while you sleep. You're like, oh man, I did it so much, I dreamt about it. Well, that's your body's way of naturally improving, because it's saying to itself, well, obviously it's important. This dude did it 500 times all day long, so let's work on that tonight. And so that's a simplified version, but you sleep on it and wake up the next day. And so going through this BioDrive process, there was a lot of sleep on it moments where we're, pulling our hair out. And then the next day we come in and one of us says, I got an idea, and it brought us closer to that final process. And it's just not an old wives' tale. There is real science on it. And I apologize, I don't have any references for you, but if you look up on it and the science behind sleeping on it, you might be surprised what you find.
Yeah, definitely. And I'm no expert, but from what I understand, it has to do with a little bit of myelin, which is sort of the grease for the groove with your neurosynapses. And so and that increases during times of deep sleep. And so when you're able to have extended periods of deep sleep, which is, the delta brainwave sleep where nothing is happening, no dreams, no nothing, just growth, just brain growth, basically. It's super cool.
Right. The correlation between the hours that you sleep and your learning capacity is a direct correlation. And the more you sleep, the more your capacity for learning just increases exponentially. You become healthier. It's just a lot of benefits to sleep, but sleep on it's one of my things.
Yeah, I love it. And I think that we're so prone to cognitive biases in our waking state that we have a habitual way of thinking about things. And if you're able to go to sleep and sort of pose a question to your subconscious before you fall asleep, your subconscious doesn't have any of these cognitive biases. It just is existing and pulling things from every last place that you've ever learned something in, and is able to put things together that your conscious mind might not be able to do.
Right on. Well put.
Cool. Yeah, so it's fun. I love that. I geek out about all that stuff.
Yeah.
So cognizant of your time here, I'm going to get to our very last question, which is, if there's one specific thing that you can see change within the medical cannabis industry, what would you like to see?
That's a good question. I hadn't prepared for that one, but the first thing that pops into my mind, just being honest, is regulation. There's a lot of guesswork on the manufacturing side. We're an ingredient producer. That's how we view ours. We're a biotech company who produces ingredients. And so then we bring it to the next guy who puts it in a product, essentially. And, the questions that they have on how this can be represented on a label, there's no answer to. There's a best avenue to take, but there's not the avenue to take. If I'm making a protein product, I know exactly how to make it. If I'm making some multivitamin, there are very clear-cut rules on how to do it, how to dose it, the warnings, all put out by the FDA. I would like to see more guidance. It'll normalize the ingredient. It'll normalize the industry, and we can take it to the next step after that. Until then, you're going to find it in these gas stations and these odd places in various forms and various levels of reliability, unfortunately, until then. So being a person in the industry, I want it to be as responsibly regulated as possible. So if I had that wish for one thing, that'd be it. But I'm sure I'll think of something better once we hang out.
Yeah, that's a good one. That's a good one.
Yeah.
Not a lot of people are looking for more regulation, but this is an industry where it's needed because it is the wild west.
It is needed. There. Yeah, it is, and that's a step in a maturing market or a maturing industry, and that's obviously what's needed most, in my opinion.
Great. Well, did I miss anything? Is there anything else that you want to cover?
I think we covered it all. BioDry and its sister product, the CBD Bake Mix, like I said, is going to be officially available sometime in September, probably early September. The company is Hemp Synergistics. Search us on the web, find us that way. And we have a variety of professionals in-house. I'm the product designer. We have actual formulation chemists who know more than me. We have branding experts who are better branders than me, and then everything in between, distribution and marketing in general. We're a full service company, and it's an exciting time. And again, I appreciate the opportunity to talk about this stuff. Like I said, it's my first time speaking out loud about it, and looking forward to what the future holds.
Well, you did great, so don't worry about that.
Yeah, thanks.
Yeah, and it was excellent. Such great information and a really, really cool product and a really cool innovation within the space that we haven't seen yet. And I'm excited to see how much more creative you guys can get and maybe even get a 10x concentration by avoiding all the rules that people usually play by.
We'll see. I'll keep an open mind to it, and then I'll sleep on it.
Okay, great. So again, it's Hemp Synergistics is the company, and you can find out as much as you need to about them by looking it up.
Right.
All right. Well, great. Well, thank you so much, Mark, for your time. I really appreciate it, and have a beautiful day.
Thank you, Matthew. You do the same.
There it is, folks. Mark really brought some great information, and this BioDry sounds like such a cool product. I think it's going to make it possible for cannabinoids to be in almost anything. We'll be able to have access to this medicine in a way that we have not been able to have it before. It's so cool. And Mark's just a great guy. It's one of the great benefits of doing this show is that not only do I get to bring incredible information to all of you, I get to learn a lot myself, and I get to meet some really cool people. Mark was definitely one of them. So I hope that y'all enjoyed this as much as I enjoyed being able to interview Mark. And please check him out. Check out Hemp Synergistics. And make sure you head over to Apple, head over to Google or Stitcher or Amazon or Spotify or wherever it is that you might be listening to this podcast, and give me those 5 stars. 5 stars, woohoo! Because I would love to see those stars, and I'd love to hear from you. So reach out, Matthew at edgeofcannabismedicine.com, and until next time, folks, please stay healthy and enjoy yourselves. This Edge of Cannabis Medicine podcast is copyright EM2P2 Inc. 2020. All rights reserved. Podcast use and availability is governed by terms and disclaimers available at edgeofcannabismedicine.com/terms. I'm your host, Matthew Myro, and thank you for listening.